Do the Democrats have the votes they need to pass health care reform this week? Joining me to discuss this, two congressmen who will have something to say about that. Democrat Eliot Engel from New York and Georgia Congressman Tom Price joins us from down in Atlanta. Gentlemen, good to have you with us.
Good to be here.
Okay, look, it really gets down to counting the votes. And Eliot Engel, since you represent the party that is in power in the House, do you think Democrats will have, by some unofficial counts, they may be a little short? What say you?
Well, I don't think the votes are there right now. I mean, we haven't seen the bill, and I think that we need to look at the bill and see the changes before we can commit to votes. I mean, I've said that I need to see the provisions that affect my home state. I want my state to be treated fairly, and I'm not going to commit my vote before I see it. But I am for health care. I did vote for the previous bill. And I think that if things go right by the end of the week, the Speaker is hoping to have the votes in place. But
so it's sort of an important question here, and I don't want to interrupt you, but what would cause you to say no on health care reform? Is there anything they could do that would make you say no?
Well, I think that states need to be treated fair and equitably. My home state of New York has been very generous in terms of providing health care for our citizens, and the formula in the Senate bill is unacceptable, where we are actually penalized for doing so. We don't want special treatment. We just want fair treatment. And I would have to make sure that the things that are in the Senate bill that I think are unacceptable are not in the finished product.
Well, let me get Congressman Price in here. Congressman, as you look at what's going on and size up the situation, do you think that this is going to pass in the House as it stands right now?
Well, it's interesting that my colleague says that the Senate bill has to change when, in fact, that's what the House has to pass in order for this reconciliation proposal, this convoluted process that they have selected to move forward. The Senate bill has to pass, so every member of the House who wants this bill to go forward has to vote for the Cornhusker kickback, has to vote for the Louisiana Purchase, has to vote for all that inequitable treatment of New York and virtually every other state across this land because of the special favors and the things done in back rooms in the Senate in order to get the Senate bill to pass. That's what has to pass the House first. That's what's unacceptable to the American people. It's unacceptable to me and my colleagues on the Republican side of the aisle. And we believe that at the end, that those individuals on the Democrat side who will be voting for this will hear from their constituents loudly and clearly.
How important will be, Congressman Price, the issue of abortion in the coming debate?
Oh, it's hugely important because the status quo, what the nation has said for over 30 years, is that federal tax dollars ought not go to pay for the provision of abortion services. And that's what Representative Bart Stupak, a Democrat from Michigan, has stood strong with about 12 other members of the Democrat caucus in the House of Representatives to say that they believe that that's what ought to happen. In fact, that's what was included in the House bill. Now, the Senate bill provides for federal monies to go for the provision of abortion. So if those voting for this bill in the House of Representatives will be voting for federal monies to pay for abortion
I want to keep
services.
this fair and balanced on the time as best I can. Congressman Engel, your thoughts about this issue of abortion and whether or not it will cause a real problem for some Democrats, a lot of heartburn for some Democrats?
Well, the way I read the bill, both the Senate and the House versions keep current law which prohibits government funding to be used for abortions. But I want to comment on something that Tom said about reconciliation. I mean, let's get our facts straight. Since 1981, 14 of the 19 reconciliation bills have been signed by Republican presidents. The Bush tax cuts were done under reconciliation. Welfare reform was done under reconciliation. So to sort of say that this is somehow something that is differing from the norm is not really true. It's true that we have to pass the Senate bill with the caveat, with the agreement that it would change by reconciliation, would modify the Senate bill, and that's what we're going to do. But frankly, the devil is in the details.
Well, I
want to see the details.
Congressman Price about 15 seconds to answer that.
Well, what the American people don't want is a government takeover of health care, an increase in the cost for health care, and a decrease in services and no lawsuit abuse reform. Those are the kinds of things that the American people don't want, and that's what's in the Senate bill, and that's what's ultimately going to pass if Mr. Engel and his colleagues have their way in the House of Representatives.
This is not a government takeover of health care. Absolutely not.
We're going to have to leave it right there. Gentlemen, thank you so much for the debate. I think we've got a good sample of what is going to be coming in the week ahead.